For our lunch presentation today, we have the opportunity to learn a little bit more about Weber State's Dr. Ezekiel R. Dumke Family Pre-Medical Profession Program. And we're going to once again hear from Dr. Yasmen Simonian, who's the Dean of the Dumke College of Health Professions, as well as from Dr. Barbara Trask. Dr. Trask earned her undergraduate degree in biology at Southern Illinois University and then worked as a research technician at Monsanto, where she explored pharmaceutical interventions for such disease processes as metastatic cancer, osteoporosis, and inflammation. She left Monsanto to pursue her PhD in molecular biology, which she earned from Washington University in St. Louis in 1999. She completed 2 postdoctoral fellowships and then began her teaching career here at Weber State University in 2003. She is a professor of zoology and is the Associate Dean of the College of Science, as well as the director of the Ezekiel R. Dumke Family Pre-Medical Profession Program. Just wanted to note that Weber State has a great track record for placing medical students. Of their pre-medical students who apply for schools, over 65% get accepted. So that's excellent, and we look forward to hearing from them.
How you doing? Are you doing great? Time for food, time for lunch. Welcome. I'm just here to tell you. Here.
Oh, you got it. Okay, got it.
This is going forward.
Okay.
That's going backwards. That's the pointer.
Okay, got it.
We're here to tell you that we're a team. We work hard to make sure our students get into med school, dental school, vet school, all that. But med school right now, high acceptance rates, and we all work together to make that happen. So welcome to Weber State. Welcome to College of Health Professions and College of Science presentation. And I want to know, if you're not in the line, if you're in the line and you can still hear me, I want to know who's a graduate of Weber State. I want to see alumni. Hands up. Okay, I'm turning the time to Dr. Barb Trask. Here she is.
Thanks, Yas. I want to talk a little bit about the pre-med program and the successes that we've had, but mostly I want you to hear the experiences of some of our students. So I'll introduce a couple of those after I've given you a little bit of background information. So first off, Weber State, the College of Science, where I am housed, has about 1,200 total students. About half of those, slightly more than half of those, have chosen to major in zoology, microbiology, or biochemistry. A large proportion of those are pre-medical students. We have started tracking pre-medical students at Weber State over the past year and a half, and 356 students have self-identified as pre-med specifically. Those are in the College of Science, in the College of Health Professions, and actually scattered around the university, majoring in other things as well. And I have another slide upcoming talking about how those are distributed across campus. We have an average of about 40 to 42 students who apply to medical school every year. It vacillates, so I have a little graph here showing you that we have had as many as 50 students applying, and we have had as few as 30 students applying every year. But they have spanned campus, as I said. Hey, Crit, I see you in the back. How are ya? Good. Crit was one of these right here. These are the distribution of our students across campus. The majority of students who apply to medical school every year, and this is several years worth of data, most of those students have applied from the College of Science, and as I said, primarily those three majors that I mentioned before. But we have a large number of students who apply from the College of Health Professions, almost exclusively, although not exclusively, but almost exclusively from the Medical Lab Science program there. And we have a number of students who are applying from social and behavioral sciences, mostly psychology and neuroscience majors, and some applying from arts and humanities, and the majority of those students are majoring in foreign language. As has been alluded to, we have a very high acceptance rates for our students. This is our multi-year sort of stats showing you how many students we've had, or what percentage of students we've had accepted to medical training programs over the number of years that I've served as director. This is the national average. So about 40% of students who apply to medical school every year are accepted, and with the exception of 1 year, we have superseded that 40% acceptance rate since I've been in this role. That several year average is at 60, slightly above 62%, as the little table tents on your table have indicated. So people ask me why our students are accepted at such a high rate, and I can't really answer that question, but I can, I do take some of the I guess some of the responsibility for that, and that comes in the fact that I do spend a lot of time with our students in a number of different ways. We have multiple information sessions that we hold at least a couple of times every month to provide people with incoming students with a little bit of background about what the pre-medical program requires of students. I do one-on-one advising with any student who wants to meet with me. In the past academic year, I've had 145 of those individual meetings. I also have meetings for students who are planning on applying to medical school the following year, so they can get a year advance on a timeline. And then I meet with every student individually at least for an hour to talk about his or her application. We talk about the schools that that student is planning on applying to, so we can target a student's application and the qualifications that he or she brings to the table to the specific programs. That actually necessitates that I know a little bit about all of the medical training programs that are around the country, and I know the admissions officers at those schools, so I can make those appropriate connections. We also have relationships with entities across campus, like our Center for Community Engaged Learning, our Office of Undergraduate Research, and our Career Services. The latter of those engages in some mock interviewing of our students prior to going out on their actual on their interviews at medical training programs. I showed this slide last year, but I do want to, some of the numbers have changed because we look every year at what our students are doing. What our students are doing extracurricularly is sort of dictated by requirements for the University of Utah's medical training program. So although this is a bit busy slide, you can see a number of categories: volunteer service, leadership, engaging in hypothesis-driven research, exposure to patients, and that means direct contact with patients through employment as a certified nursing assistant, as a phlebotomist, or voluntarily through a hospice organization or working for an organization like Center for Grieving Children or something like that. And then physician shadowing. So that's learning about the career from the physician side of things. At present, I'm going to skip this one actually. At present, I want to introduce to you one of our students who is applying this summer. Let's remember that he took the MCAT last Saturday, so he's still a little shell-shocked from that. But Greg Mayer is a senior at Weber State. He expects to graduate in December. He is his majoring in Spanish, although he is often mistaken for a College of Science graduate by the sheer volume of time he spends in the College of Science. And he'll be applying this summer. And he's going to talk a little bit about his shadowing experience that he had this past year. Right?
Thank you so much, Dr. Trask. I think a huge part of getting into any career or any field is knowing what you're getting into. And the best way to know what you're getting into is to shadow someone who's already in that. We have a wonderful program here. It's called the Preceptor Program that allows students to shadow physicians in many different aspects and regards. I've been fortunate enough to shadow with Dr. Rifleman and Dr. Mosinger. Dr. Rifleman has been interesting because it's family practice, and I'd never had an interest in family practice until I shadowed with Dr. Rifleman. It has opened my eyes to the schedules that he keeps as a physician, and opened my eyes to all of the aspects that go into being a physician, not just running into surgery or attending meetings. It's also patient exposure and really getting to know your patients. I feel that I have learned what physicians, the qualities that a physician needs to have through shadowing, and by trying to exemplify those qualities, I will be able to be a better physician. I think that's it for you.
Thanks, Greg. Thanks, Greg. So I do want to, our students would not be able to have the experiences that Greg has talked about without you all being willing and available to serve as mentors for our students. And so I want to thank those physicians who have allowed our students, and in fact have mentored our students over the past couple of years. So these are just a few of the physicians. Hopefully you recognize your name. But if you don't recognize your name, we are going to ask you if you would please be willing to volunteer your time. Of course, students at the University of Utah have to have, in order to be considered for acceptance at the University of Utah, they must have over 25 hours of shadowing. The average student who is accepted, in order to be competitive, has to have around 40 hours of shadowing. So in order to make our students competitive for the University of Utah, and in fact other training programs around the country, we have developed this clinical preceptor program, the program that Greg talked about and that he engaged in. As our clinical preceptor program, a student must shadow for those 40 hours. That shadowing typically occurs within one of our 14-week semesters. In addition to shadowing those 40 hours, and the student is responsible for keeping a log and a journal about that experience, the student must also meet with me, and then the student must also turn in an essay that is, let's say, the start of, or at least the first draft of an essay that will ultimately be on the student's application when he or she makes application to medical training programs. We are very fortunate to have 3 students who have volunteered their time to serve as our preceptor coordinators. You see their lovely pictures here, and they are sitting at the front table. We have Eric Lancaster, who has served as a clinical preceptor coordinator for us for now, this is the 3rd year, right, Eric? Andrea Mancia is in her 2nd year of helping us out, and then Miranda Speth is joining us this year so that we can keep the continuity going. If you have questions about the clinical preceptor program and the demands on your time for that, or hopefully, if you're willing to serve as a mentor for one of our students, that you will find Eric, Andrea, or Miranda in the crowd. They'll be here both today and tomorrow to collect information from you, and will very likely, you will be hearing from them shortly, as we're arranging fall semester right now, or participation in fall semester. I want to switch gears just a little bit right now, because I want to talk about, I want to introduce you to one of our former students, Ryan Anderson. You heard his father talk earlier this morning, but Ryan is one of our graduates, graduated a year ago from our medical lab science program in the College of Health Professions. He made application last summer, and I wanted him to take a little bit of time to talk to you about the process and the related, the things related to the application process itself. So I'll introduce Ryan right now.
So I'm a little jealous of Greg. He got to talk about more fun things than what I am talking about. But do I move? How am I moving this? Am I?
The green one.
Okay. So I just want to talk about, first I want to thank you guys for letting me be here. I'm grateful for all of you. I look forward to the time when I'm done with med school and residency, where I can be in your shoes and be here to learn about different procedures and how to better treat patients. But what I'm talking about is kind of the fun things you guys probably don't, the not very fun things you guys don't like to remember that much, and getting ready for the MCAT, which Greg just took, and how we pay for that, and as well as the cost of applications and all that stuff, and how students kind of deal with those fees and everything. So the MCAT, most students, I would say at Weber State, they do an MCAT course. So whether that be Altius, Kaplan, there's Princeton Review, Next Step, there's a bunch of different courses you can do. I would say a common one here are both Altius and Kaplan. That's what I did. And the majority of those costs are about $2,300. So they're really expensive. Not only is the test a stressful time to study for it, but to take courses to prepare for it is very expensive as well. A lot of people like to self-study for it. But so just getting the materials, the books, and the practice test cost about $500 to $1,000, and then actually paying for the test is about $300. So
That's if you take it once.
yeah, and that's if you take it once. If you take it again, you pay for every time. So it's expensive, as well as certain people, when they retake it, they pay for different courses or different books. So it's an expensive process. So so me personally, I did Altius, and so I spent the $2,300, and I had a group about 15 students. I think I was talking to Greg, and he did the same thing, and then the cost of the MCAT. So I was about $2,600 in for that. And then after that, right after you finish the MCAT, you have to get ready to apply. I would say the national average is maybe 15. I don't know what Weber State's average is, but I wanted to do a little more to make sure I got on in the first try. So I did 20 schools through AMC, which is the MD applications, and then I did 4 through Texas. So I did 24 total, and the cost of just AMC writing the primary and secondary essays was $2,800 for me. And then adding on Texas to that, Texas is a little bit cheaper, but it was just $200. So I was $3,000 in just writing essays. And then once interviews come, you have to get ready for flights and paying for all those. So it gets really expensive. I got invited to 9 interviews. I decided to only go to 7 to try to save on money, and I'd already been accepted to a school. So with the 7 interviews, it cost $2,150, but I felt pretty lucky with that, because luckily I had some influences in my life. My brother, he was a resident when I was getting ready to apply. He was in med school. And so he told me some things to do. So I worked part-time, as well as my wife worked part-time while I was in school. So we'd saved up about $10,000 to get ready for it. But we also got a Sky Miles card. So we tried to get Sky Miles to get ready to pay for flights. We had 2 flights paid for, which was really helpful. And then one of our interviews at Utah, so we didn't have to fly anywhere there. But we still spent over $2,000 in that, and that's not even including hotel rooms, because I was lucky enough to stay with students at every school. But if I were to add in hotel rooms and maybe the 2 flights I didn't get paid for, it could easily be up to $4,000. So when we get the total there, I spent nearly $9,000 in applications, which is pretty typical. I had some friends that were in $13,000, and also there's certain schools where you have to pay a down payment to go there. So I had one friend that paid a down payment of $2,000 for a school, and then he decided to go to a different one, and you don't get that money back. So applications can get very expensive, and it really is. You have to plan for it, and you have to prepare for it. But as you do so, it's doable, but it is very tough on students, especially, having to work different things. But I'm grateful for the opportunity I had to go through it. I'm grateful to be done and get ready to start medical school, and I look forward to the day where I can be like each one of you, and I'm grateful to be here to learn from you guys.
My name is Danette Pulley, and I have the privilege to help support our students with their dreams. I support the College of Science with development opportunities to support our students in what they're trying to do. So it's a real opportunity for me to follow students like Ryan and Greg and talk to you today about the opportunity to support them in their medical pathway and achieving their dreams of being the next generation of medical professionals. So today we are launching an opportunity for you to support Weber State pre-medical students with the Medical Pathways Fund. This is something that there's some information on your table, but really I want you to take a minute and think back when you were in the shoes of a pre-med student. And I want you to think for a minute about the pathway of people and experiences, shadow opportunities, and supporters along your way that helped you get to where you're at today. And we know as a society of medical and surgical professionals here in northern Utah, your partnership with Weber State is critical to our students' success as they come and learn what it means to be a medical professional. And as they work hard to prepare and get to the place of application, we are looking forward to creating a fund with your help that will support them with the laundry list of costs associated with achieving the dream of going on to medical school. So with your support, we hope to be able to provide support, financial assistance to the students here at Weber State that want to achieve the same dream and follow in your footsteps of going on to medical school. Is that working? Through the green arrow. Okay. So there's many ways to give. I'm just going to keep the information brief right now. The most important thing I want to make sure you understand is that we have this opportunity, and it's so incredible to be able to give back and pay it forward to our bright students who are working hard to continue to provide compassionate care in our world today. So if you have any questions or information, if you're interested, I will be outside at the Weber State table, and we've got some flyers. There's information on your tables as well, and we will follow up after the conference as well. But we want to make sure you know about how you can support the Medical Pathways Fund as the Ogden Surgical Medical Society.
Good afternoon. Welcome to our lovely Weber State campus. My name is Andrea Easterpilcher. I am the relatively new dean of the College of Science here at Weber State, and I am already bleeding purple. Thank you very much. I really appreciate the eloquence of my colleagues here today, and especially of our students. That was really great, so thank you to them once again. One of Weber State's values is access. And as you can see, based on our student and faculty presentations, we have extraordinary faculty and we have extraordinary students. Unfortunately, as you've also heard, there are huge costs associated with these students applying to medical schools. These costs can add up, and they may even discourage some of our promising students from applying to medical school. The administration and faculty of the College of Science and the Dumke College of Health Professions do not believe that the costs associated with applying to medical school should be a barrier to our Weber State University students who aspire to become physicians and surgeons. As such, the Medical School Pathways Fund, as Danette has introduced it, and support from professionals like you for that fund will go a long ways towards helping WSU pre-medical students who might otherwise be unable to apply to medical school. We know that our students are very well prepared. We know that they are ready to succeed in medical school, and we know that there is urgent need for doctors worldwide. So we do not want our qualified students to miss out on medical school opportunities because they do not have the necessary resources available for them to meet medical school application demands, to optimize the preparation for the MCAT, and to help them with travel to medical school interviews. I actually was blown away by the cost of this. I knew it was expensive, but really looking at it, wow. So I just want to say, I actually am presenting tomorrow morning at 7. I'm a wildlife biologist, so it's a whole different thing for me, but I will be walking through the programs in the College of Science and undergraduate research that we're doing and hands-on experiential teaching and learning. So I hope you'll enjoy that. We really appreciate your consideration and your time here today and the attention that you have given to our cross-college collaborative team. We are all here striving to make the world a better place, so thank you very much. If you would like to learn more about our College of Science and the Dumke College of Health Professions, please feel free to visit our table in the lobby. Thank you.